Hi, I'm Jill, and this is a video about my thoughts about nursing and ethics and law. And one thing that I'm really excited about that I think pertains to ethics and law in nursing is evidence-based practice, so EBP medicine. And I think it's really, really, really important that we're all doing this. One of the things that I kind of looked ahead in our unit 2, and I noticed the Lewis Blackman video, and I think in that video there was like a definite failure to rescue that patient. But if they had been following evidence-based practice, it wouldn't have happened in the first place, because they wouldn't have given him the ketorolac after his surgery, and he wouldn't have had the GI bleed. And so I just think it's really important that we're all up to date on current practices, current guidelines, current research, and we're really lucky that we are practicing in this time right now, because all this evidence-based medicine comes out really quick, and we have access to it on the internet. We have smartphones, we have guidelines. We're using medical health, or we're using electronic health records that have these guidelines built into the records and the medication dispensing, so it tells people not to make this medication error, this medication mistake. And so I think that's really wonderful. I just think people need to utilize it, and it's just an ethical basis that you have an ethical duty to your patients to to keep learning and to utilize all of these resources. Not using it is, to me, it's the same as lying by omission. Just because you didn't see it doesn't mean that you shouldn't be using it. And then I think that what goes hand in hand with evidence-based practice is also the collegiality, the environment of evidence-based practice, that there's more education, like there's more standards as well, and so with that, there's just an environment in the hospital, this environment conducive to learning, conducive to evidence-based practice, conducive to just having an attitude of learning, instead of the one thing I think of from nursing school is the nurses eat their young. And it's kind of true. I've seen it when we were doing our clinicals, where some of the nurses, instead of being helpful and teaching and really fostering an environment of collegiality, there's this hierarchy, and and they're trying to make people feel bad, or they're being bullies, or whatever it is. And I don't think anybody learns well. And then there's patient mistakes, because if you're not learning, or you're afraid to admit that you made a mistake, or afraid that to admit that you didn't, that you don't know something, then you might just do it and not do it properly. And to me, that's just awful. And and so I really like with this evidence, or the collegiality, the evidence-based practice, the safety disclosure, so people learn from their mistakes, and it's not punitive. It's a learning experience, and there's more reporting, so we learn what it is that caused the mistake. And that was also in the Lewis Blackman video as well, just about causing the systems that break down, that cause those mistakes, and then people how to go ahead and fix those mistakes. And so I'm really excited about that. And I think also just that people are aware of of ethics and law and how they pertain to nursing, because we do have an ethical duty to our patients. And I think it's really important not to abandon our patients and to advocate for our patients. I'm kind of big for patient advocacy, and also for patient education. I really think that if you don't educate the patient, then how can they actually make an informed choice? And they can't. We have all this education. We go to school for years, several years, to get this education, and I just feel we have an ethical duty to pass it on. So those are kind of my thoughts about ethics, law, and nursing, and I'm excited to keep going in this class and learn even more. All right, thanks, bye.